Jim Austin tonight is one of our faculty members here, teaches leadership and workforce development, so really in your wheelhouse. Has been senior executive at Baxter Healthcare, in consulting for many years, Arthur Little, etc. Teaches at Wharton, teaches here at Brown, a number of places, all around great guy. So, so we're happy to have Jim here to moderate the panel. We have Rose Sheehan joining us. Rose is currently the Chief Human Resources Officer for the Mass General Brigham, which is not just Mass General Hospital, but an integrated academic healthcare system, which comprises Mass General Brigham, 6 community hospitals, 3 specialty hospitals, 4 physician organizations, healthcare at home, and the Mass General Brigham Health Plan. Mass General Brigham is the largest private employer in Massachusetts with 82,000 employees and a complex labor environment of 24 bargaining units. So Rose has a big job on her shoulders. She's worked in various leadership roles in healthcare, among them being the Vice President of Revenue Cycle Operations, Executive Director of Professional Billing Offices. She has her BA in chemistry from Assumption College and earned her MBA at Babson. So she brings some really great experience to the table here. Next, we have Matt Salmon of Salmon Health and Retirement. As he says on his own bio here, he has been groomed for this role since childhood. He's the 3rd generation of the Salmon family to work in caring for the senior community. So it's kind of part of his DNA. He began his career at the company as a physical therapist, that he achieved that degree from Northeastern University. And after sort of getting his hands dirty with the hands-on PT work, he moved on to be the rehab director, first at their Natick campus, and then moving into that role company-wide. He's continued advancing throughout the organization, and now is responsible for the entire organization as CEO of Salmon Health and Retirement. And lastly, but not least, I'm joined by Jeff Mogan, who is the head of employee relations and HR compliance at Mass Mutual in Boston. Prior to, he's been there for almost 4 years now, and is a proud graduate of this program, the Master of Healthcare Leadership Program. He, at the time that he was in the program, he was the Senior Labor and Employee Relations Specialist and HR Compliance Officer at UMass Memorial Medical Center, a large healthcare system in central Massachusetts. He is also an attorney by training, so bring some labor compliance and thoughts on those areas, and all around great guy and a wonderful alum. So thank you all for joining us. For those of you who are online on the webinar, you can put questions in the Q&A function of the webinar, and we will try to address as many as we can as we go through. Thank you.
Great. Sandy, thank you very much, and welcome everyone. I think what we'll do tonight is, for the first 45 minutes or so, have a discussion here with the panelists, because I'm really honored to be with these 3 individuals. And then for the last 45 minutes of our time together, let's open it up for questioning. So let me start us off. A real simple question for our panelists. Where do you think the US healthcare system will be 5 years from now? Who would like to start that one?
I'll hand off to my colleague.
Please, exactly.
Where do I think that wasn't in our pre-meeting discussion. Let's just start with that. So
we're supposed to be talking about HR. No, but setting a context.
And again, so my background obviously is it's in long-term care. So we have nursing homes, independent living, assisted living, skilled nursing. We have a home health hospice, private duty company. We serve about 58 or 60 towns in central Massachusetts. We also operate a child care center, and that's mostly for our staff. We'll talk about that later. I think that when you talk about the state of healthcare in 5 years from now, it's 2 things, right? It is about what we as a country are going to invest in making sure that people have access in the care issues. Right. And the other piece to this is what we're going to talk about tonight is staffing and your ability to provide the care. I think in 5 years from now, unfortunately, we'll probably be in the same or worse condition that we're in now, in terms of us being able to hire and having staffing in whether it's your nurses and patient care ratios, or having your primary care physicians and some of those general practitioners available to provide the care that we're going to need to provide to an aging population in this country. That we have this dynamic of less and less people to provide care at a time when this country needs more and more of it.
Yeah.
So that
More and more
really is
demand.
going to be a problem for us.
Yeah,
Yeah,
no,
I mean,
exactly. Rose,
the
please.
McKinsey study that was done earlier this year predicts that by 2030, we will have a shortage of about 450,000 nurses. It's about 10
Nurses alone.
Nurses alone. And that's about RNs, registered nurses. That's about 10 to 20% of the demand that we'll require by 2030. So I 100% think that's going to be one of the big challenges. I think we're going to have to automate and get more creative.
Okay.
So
Okay.
I don't think we can just keep doing what we're doing and expect anything to really change. So I think healthcare is slow to adopt technology, not clinical technology. By the way, it's quite good at adopting clinical technology.
Yeah.
It's not great at adopting workflow changes and process changes. And so I think we're going to have to change the way we provide care. And I think you're going to continue to shift a lot more to ambulatory settings out of hospitals.
Well, and I was just gonna, and before I shift to Jeff here, you have that mix, 80,000 plus employees. Do you see more of that shifting away from the tertiary care to the outpatient and so on, community health?
That is 100% what we're trying to do.
Yeah.
So we have the largest hospital at home program in the country, and it's still tiny, but everyone's experimenting. So trying to really keep people out of hospitals, and that seems crazy, but trying to keep the beds open for people who really need a bed.
Right.
So that you can shift the rest, and in order to do that, you have to shift the rest of the care out to the community.
Sure.
So-
Sure. Jeff?
I'm going to answer a different question, Jim.
Please. That's why you're at the end.
But they've addressed kind of the macro, broader healthcare level, but kind of the more micro level within it, from my perspective, coming from employee relations, law, HR compliance, some of the things that we're seeing, and I think we'll continue to see over the next few years for trends and particular issues that'll drive some of these broader changes and developments. One certainly is increasing complexity and regulations and law. I mean, we're seeing,
Interesting.
for those who operate in one state, you've got your hands full. For those of us who operate in almost every state or globally, it's becoming almost unwieldy in the amount of the pace of new laws, legislation, and the patchwork. And so, trying to keep up with that is something that I think organizations just have to more and more invest in and devote to, because you can't take your eye off the ball for any period of time, and something new is popping in. A few other that come to mind, they're all big topics in themselves. We could probably spend the whole time just talking about, but to flag, not necessarily new, but I think it's going to continue to take on more and more importance, is employee health and well-being. I mean, in my experience, we've had more folks, using the employee assistance programs, coming forward saying, I need help, I've had issues, employees reporting in a positive way, coworkers who are saying things that concern them. And I think that's something that's just going to continue to be a real focal point. If we want to have a functioning system, we need to have people that are getting help and functioning as well. So,
and what I hear in that too is this tension maybe between the state versus federal. You want to comment on that, Jeff?
Yeah, I mean, certainly in healthcare, there's that big tension. Again, for those of us, MassMutual operates in almost every state, and we have offices in Romania and India that we're dealing with, and the complexity of mixing and matching all those and being effective is just increasingly difficult. Then on top of that, you get the federal layer, so it's a challenge. That's why we're all here, right?
I will say, I think
please.
that the conflict is, it's what we need to do versus what we're getting paid to do.
Correct.
And then as you say this, that we're talking in one hand about, we all know, right? You guys are all somehow related to, I think, to the healthcare industry, that we do have to get everything out of the hospitals. It is less expensive. It is more efficient. But in 2021, I closed a nursing home in Worcester, Massachusetts, in order to sell the building to UMass, the UMass Memorial Health System. They are spending $70 million on that building. It's going to be a 72-bed inpatient. It's their new North Pavilion. And I was having dinner with Eric Dixon, the CEO of the hospital, on Saturday night, and he said that if they could open it today, it would still be oversubscribed.
Yeah.
Right? So we have this dynamic where we're still using hospitals in a traditional way when we should be moving in the opposite direction.
Yeah.
Well, and moving to really the content of why you're all here, success stories for employee attraction and retention. Right? And I let me start with Rose, because I think that figure of 400,000 gap, which today is largely filled by foreign workers, right?
Actually, very few on the nursing front.
Ah,
Yeah,
interesting.
very
Okay.
few. And the hurdles are actually pretty high to hire.
To get the
foreign trained
visas and,
Nurses, yeah.
okay, okay.
I think, so on the nursing front, it's gotten worse. So the shortage in 2019 was about 40,000 nurses. By 2021 it was 107,000 nurses, and it's projected to be 450,000 nurses. And there's several dynamics that are pretty concerning. The younger group, so it's like 25 to 35 and then 35 to, or 34 and then 35 to 45, are exiting the workforce at higher rates than we anticipated. So like 6% and 7%. So we have young people who are the future of our nursing
out.
staff opting out. And then we're seeing a lot of retirements. And then we just saw a lot of people during the pandemic exit. And I think the statistics are pretty clear that the pandemic really impacted women more than men. A lot more women left the workforce. And it really was impossible to homeschool your children and go to work full time. And so someone ended up making sacrifices. And so we saw a lot of nurses either reduce their hours significantly so that they could work around their kids' homeschooling schedules, or just opt out completely. So I think we have a significant set of challenges. We also don't have enough preceptors or educators, faculty in nursing schools. So we could probably fill those slots,
Yeah,
but we can't precept them in the hospitals.
right.
So we don't have enough nurses to precept them, therefore creating an inability to actually create more new nurses. And so I think it's a significant challenge. We are trying a lot of different tactics and strategies. It's not one thing. It won't be one thing. And we're ultimately trying to figure out how to develop our own workforce and reach into communities that may not traditionally have gone into nursing programs, trying to reach into those communities and create programs to develop staff.
Sure.
So.
And in the same way, before I get Matt and Jeff, I mean, one of the deficits is primary care doctors too.
Yes.
And so how do you see that working out, the mix of subspecialists within your
Yeah.
organization?
So we've lost a lot of primary care physicians. Some of them leave to other types of organizations that are
Interesting.
more primary care type focused, like One Medical or Oak Tree, or there's a lot of competitors in
Yeah,
healthcare
yeah,
now.
yeah.
And so physicians do have options. We see the same thing though with faculty or physicians who are reducing hours, going part-time, trying to figure out how to balance everything, which was really difficult for them. And we're filling the gaps with more nurse practitioners and physician assistants.
And Matt, I was interested, you mentioned childcare. I assume you're trying to do some things in the infrastructure, or what I would call the infrastructure, to try and hold on, to retain, or be more attractive, or your comments on.
Yeah, I think that, our hands-on caregivers are largely women. They are still oftentimes in very traditional roles
Yeah.
where they're managing childcare. And again, for us, when I start to look at solving what we can of our staffing problem, I come back to turning into what can we do to make the work experience better. It's not always about payroll and benefits.
Yep.
It's how do we make sure that we can offer you a good, stable work environment. And part of that was offering childcare. So when you look at the utilization of our employees using our childcare centers, it's up and down, right? My kids are now 15 or 17 and 19, and they both went through our childcare center. All of my nieces and nephews did. but we only use that for a certain period of time. And so it depends on where you are in your life cycle when you
Sure.
come to work with us,
Sure.
whether or not you access that benefit. But it is a beautiful benefit, and it is a nice option to have, where actually we have some open space in our Westboro location now that we're looking at trying to come up with an after-school program or a day program. I'm dealing with licensure
interesting.
on that now because that's another hurdle.
Sure.
But how do we manage our 3 to 11 staff? When we don't do 12-hour shifts in our industry, it's 3 8-hour shifts. So 3 to 11 is, do we give people an opportunity so they have a safe place for their kids to be? They have a place for one parent to drop off and another one to pick up, and look at those options for our staff.
And so
that
you
way.
are looking at more flexible scheduling. We'll talk about hybrid
Yep.
specifically.
Yep.
But I've been hearing more about this flexible scheduling, allowing people maybe to work 3 12-hour days or something like that. Is that something you're looking into or doing?
Yeah, so when I started in healthcare, I started as a physical therapist, and you have to work every other weekend. You get put on the schedule. And if
Right.
you're a nurse, you work your normal 8 or 12-hour shift, and you have to work every other weekend. And there's no flexibility to
No
that.
choice.
And so what I call it now with our staff is, how do we get to Uber staffing, right? Because if you're an Uber driver, you're like, I have a half an hour right now, turn my app on and I can maybe make a
Interesting.
few bucks. That, geez, I have a half a day here that I didn't expect. How do I get that nurse or that caregiver to come in and work in an
Interesting.
industry that we're very traditional, that, well, you don't fit into our box, so we can't have you work here.
Yeah,
That how do we start to break some of those traditions and barriers down?
sure.
Yeah.
And
those
and
are-
Jeff, from your perspective, yeah, from the insurance side or the healthcare side.
Yeah, I think those are all great examples of, intentional benefits and the flexibility that relate to, what I think is really the key to the attraction, the retention, which is building a good culture, right? I mean, it's easier said than done, but really putting a company and a culture together that people want to be there, right? Because it no longer the days when having a job and paying someone is enough. They actually have to want to be there now, and you have to do more, right?
You have to have a
to engage
retention
them.
strategy.
I know.
Holy cow.
And build trust, and there's a lot of components to that which we can get into, but I think we saw for a period of time where employers were just piling benefits, pet insurance, more benefits, and they're not, people, so that's great, but that's not meaningful. I need something that's meaningful to me and impacts my life and makes it better so that I want to stay here.
I think the hard part though
Yeah.
for that is that we have such a varied staff that I totally agree on the culture, by the way, like that's number one. And there's, all the data will show you that people leave companies because of the environment, hands down. Comp is almost never the reason people start looking. Sometimes it is. And there was kind of I like to call it great reckoning around pay over the last several years, but people leave because of the environment. They will always get more money somewhere else, by the way. Like once they start looking, they'll get more money, but they leave because of the environment. But when it comes to trying to figure out purpose or, creating the kind of place where people want to go, that feels different for everyone. And so
Absolutely.
how you create that environment in a way that attracts and retains a very diverse workforce is unique and hard.
Well, let's talk for a few minutes about culture.
Yeah.
Because one, my experience is every organization has its own culture,
Mhm.
and it's incredibly hard to change.
Yeah.
So how do you try to mold or try to evolve the culture to offer more fulfillment or more purpose, or what do you think?
Well, I think it starts with a few things. I think it starts first with listening. So creating a way, and I'm sure you all have, a real approach on just listening. You have to have a vehicle by which people's voices are heard and something gets done. Because you can create a vehicle and nothing gets done, and it's the worst possible scenario. So listening is really critical. And then I think a lot of it is about being clear about your values and your purpose as an organization, so that when people come to work for you, that's really clear. It's part of the employee value proposition. It's part of why people stay. I was at a conference the other day with a former CHRO from Patagonia. And he said, if you are not a climate change believer, do not work for Patagonia.
Yeah. Oh, yeah.
Because they are super clear
Oh,
about
yeah.
their purpose. Their
Oh, right.
purpose is to save the planet. So I think companies need to be super clear about their purpose, so that when people are attracted to the company, they can see themselves in it. And then it's a lot about transparency and respect.
Sharing information.
Sharing information, communicating often, and having good leaders, because I fundamentally believe it ultimately comes down to great leaders, which I'm glad you're all here.
Well, and I want to come back to that leadership side too, but Matt and Jeff,
I think
your views on culture.
we're a third generation family business, and so culture is who we are and it's what we do. But I would take it a step further and say that you're always working on culture. The culture in working on culture starts with me and leading by example. That one of the things I think that we had to realize coming out of COVID was that we had let a lot of things go, and that our standards to what we expect and how we behave and what was tolerated changed. Because there were times you were just glad to have anybody in the building,
Yeah.
and it didn't matter what they were wearing, what they were doing, it just fine. Thank you very much for showing up and being here for us today. And the other piece of it is for, me, and I challenge our leadership team that we have to model what we expect. And that, for us, and again, in healthcare in general, but for an old family business, that you have a lot of tradition, you have a lot of standards that are, in my mind, are no longer the norm, but I have to communicate that expectation to 14 or 1,500 people who work 24/7, 365, and some are per diem, some are only, so we don't get to put everybody in a room and say, hey, listen, here's the new expectation. So it really is, and you'll hear the theme from me tonight. A lot of us, it's for me, it's focusing on our senior management team and our executives to be able to get them to understand what we're driving at. So they're repeating that story and they're living it in our locations.
Yeah, I completely agree with everything that was said. And I think, going off that, one thing I think is really important is not only the seniors and executives, but those middle managers who are really facing the
front line.
organization.
Well, I want to come
They
back
can-
to that.
Okay,
Yeah.
because they can destroy everything, right? If they go and say, I'm not really aligned to that, right? Very quickly, things will fall to the wayside.
Mhm.
And, one thing that I've been a proponent of is empowering them. And the concept that I refer to as principle-based decision-making, where, we guide them, we provide them broad principles, we have a statement of respect, we have a code of conduct, think through whatever the issue is, whatever the problem is within those bounds. And so long as you're not outside of those bounds and you've thought it through, you're accountable for the decision, right? Make the decision, you own it. And, we'll drive that resiliency and the accountability and not having that feeling like, everything is being forced upon them. And they
I
make
love
mistakes,
that.
but they learn from it. And, it's a cycle of improvement.
Well, talk for a little bit more about middle management development. And I say that because I was talking with a CEO a while ago, and he started complaining about the frozen middle. I remember his very term. How do we get these middle managers to reflect the values that we need going forward? How do you try to do that within your organizations? And then
Yeah.
come back, Matt and Rose.
It's a challenge. I mean, they're in some ways, I think have among the hardest jobs because they're getting everything flowing up from the lower levels and down on top
Right.
of them.
Right.
And they're stuck in the middle. And I think, the way I've seen for success is I said, like empowering them and having them have a voice and feel like they're in it with you. Being able to pass that on to those that they're managing.
Well, and part of this too is that balance between the values and the outcomes. It's not enough to just get the outcomes you need if you're doing it in a way that doesn't reflect. And that's what I heard both of you talking about. So Matt, your views on middle management too.
Yeah, and again, my thing comes back to, and you probably all learned it at some point in your academic careers, right? You really can only communicate with about 8 or 10 people effectively, right?
Interesting.
And that for me to sit down in a room with 300 people isn't helpful. And so we have to cascade that through.
Yep.
I think when I think about the question and how I reflect on, are my middle managers actually living the way we want them to live?
Exactly.
It comes from spending time with the line staff. And that you'll, like you said, you'll see performance and you'll understand how your buildings are performing. But if you're not talking to your caregivers, or if you're not talking to your frontline staff, you're not getting a true picture of what the work experience is.
And how do you, an 80,000 person organization?
It's so I just read a great book the other day called The Power of the Middle. and it's all about middle management. It's
Oh,
quite good.
interesting.
And it's on Audible as well. I actually listened to it, but I also ordered it.
Nice.
But
The power of the middle.
the power
Okay,
of the middle.
good.
But it's a lot about what Jeff was saying, right? It's about pushing down decision-making,
Right.
empowering your managers,
Right,
holding them accountable, but giving them the room
right.
to make decisions within those boundaries. It was very much along the same lines that you were stating. I think I'll speak about our healthcare system instead
Please.
of being kind of stereotypical. We don't, we don't have a really effective performance management process. And the way that you you have to empower managers, then you have to hold them accountable to both outcomes, but
To-
also how
to-
they do their job.
Well,
It's-
exactly.
You have to hold them accountable.
Yeah,
And
yeah,
it's, walking the halls, rounding, listening,
right.
engagement surveys, understanding the workforce. But your middle is really critical because those are the people
Yeah.
that staff leave. They
Yeah.
don't leave usually big companies, they leave a manager.
Mm,
Either they leave a manager, go to another manager in the
Mm.
organization, or they leave completely.
yeah,
So, but I do love the empowering thing. It's the only way really ultimately to, you can't manage from the top at 83,000.
no,
Like this
No.
is not, I have a team of 820 people. I can't even manage
That-
820.
right.
And I have to do exactly what was just described, which is you have to take your values and your goals and your strategic priorities, and you have to communicate to your 8 or 10, whatever, and then they communicate down, and they
then
communicate down,
yeah.
and then we have to have the listening come up.
Well, in that context, Rose, I mean, to me, what's fascinating, my dad was a physician. The hierarchy of medicine.
Yeah.
The docs want to talk to the docs, the nurses want to take over from the docs, the techs want to take over from the nurses, and know that none of those three groups really want to work with the next group, and very stereotypically. How do you break down that, given what we're talking about too? Are there
That is the hardest
three
thing.
separate middle managers for each of
Well,
the
I
three
mean,
groups?
the challenge is these units are their little microcosms.
Yeah.
Every unit
Yeah.
ultimately has its own culture. So,
Fascinating.
and nursing has a very wide span of control. It's
Mm.
really unfortunate because
Mm,
you really can't get to know deeply your nursing team if you've got 100 direct reports,
mm.
100 nurses under your responsibility. And that's a very typical span of control for a nurse leader. So, but those units have microcosms in it. It's a lot of hierarchy.
Mm,
We don't have a silver bullet.
yeah,
Like there's no easy answer.
right.
It is
Right.
ultimately about if you create the mechanisms to listen, then you'll hear about those things and you can hold people accountable. It is just discipline, block and tackling.
Yeah.
There's no silver bullet.
Right.
And it doesn't matter whether you work in a hospital or insurance company or
Outpatient
in a
clinic or
long-term
whatever. Yeah,
care
right.
rehab facility. Every one of your facilities has their own unique subcultures.
I saw Matt smiling.
Yeah.
when you were-
I just think that I agree with everything that Rose said, right? But, and then Jeff started to hint to it, is that it becomes impossible as our professional lives in our professional industries become more complex,
Mm,
that we're dealing with so much more data and so much more specificity in what we do, that people start to hone in on such a small piece of the overall business
mm.
that it's hard, it's impossible. And you think about, I was having this conversation with my wife, she and I went to PT school together. She's in healthcare as well. That the same challenges that we face in healthcare now, as she's managing her mother who's been ill for the past year. We've been talking about these things for 30 years.
Yes.
Mm,
And it's only getting more difficult because of how complex our lives are with technology and data.
mm, mm.
I was just gonna weigh in on the hierarchy. So very few organizations have done this. Mass Mutual was one of them, where we very intentionally flattened the entire structure.
Mm.
Whether this would work in healthcare, I don't know. We could go ahead and try as an experiment if you'd like. But we don't have a executive vice president, assistant vice president, directors, et cetera. We kind of threw that structure out the window intentionally, flattened it with the intent of really hoping people will take lateral moves, move up, move down. It's not, I want to go from level 1 to level 2 to level 3, be curious, go to other departments. It's interesting. I think there's pros and cons to it. Again, I
Yeah, yeah.
that wouldn't work for physicians, I'm thinking, but, you know,
Although,
there's maybe
although it's
lessons.
very flat organization on the physician side.
Yeah, yeah.
Yeah.
No,
I
that's,
mean,
that's
they,
what,
they,
yeah.
they don't have a lot of
Yeah.
hierarchy.
No.
They, you know, you have a department chair and, you
Mm.
know, if it's a big department like medicine, which is like 1,000 physicians, you
Mm.
might have vice chairs
Right.
you know, of various sub departments like cardiology but there's not like lots of layers.
No,
And the
right.
physicians have a very strong voice.
Mm,
So it
Sure.
kind of works there.
Yeah.
Sure.
Where I think it might be really hard to do is like in operations.
Mm.
When you have a COO and then, you know, I mean, they just think about the breadth of
Mm.
all the various operations. But I do think, I love your point though, Jeff, about career mobility and having people think a little bit differently than just a ladder,
Mm.
because that really, it's really about skill building at this point. Like, how do you collect skills? Because that's ultimately what you will carry with you. And, but yet people get really hung up on like, I'm an E1 and I want to move to an E2 and so on and so on. So I think
As
that's
long
a
as it
really good
translates into a bigger office. See, that's the, no,
Or-
but,
Oh,
or
who
a
has
cube.
offices
yeah, or
anymore?
cube,
Yeah, who
right?
has-
Wait,
I
wait,
was gonna say, who has
Jim, who's got an office? Well, last question, then we turn it over to the audience here. Hybrid working environment. One, how do you see it in a couple of years? And how do you see it working? What are some of your success factors? Because everything, I'm talking to the class today, everybody feels like it's in transition. Nobody quite knows where we're going to be a couple of years from now. But there seem to be a couple of key ingredients to making it work. And I'd be interested in your views on that. Matt, why don't you
Start
kick
with
us
you.
off? Or Jeff, where do you want to start?
It's such a hard subject.
Yeah.
You know, I think we've seen, obviously with the pandemic, I say everyone, but obviously there are people who had to be on site, right? There are people who have to be there, have to work, you need to physically be there. For others, obviously, you know, the majority went out. We've seen a wave of companies calling people back. You know, I think we've seen the pendulum probably swing too far one way and then now too far the other, and we'll ideally swing in the middle a little bit. I think, you know, some companies are probably getting a little too, bring everyone back, a little too heavy with that, and it'll regulate itself, I think. But I don't know, it's interesting. I mean, I think in healthcare in particular, you know, has the potential to have a real, you know, haves and have not set up where, you know, the vast majority of your folks need to be there, and you've got the elite few who can work remotely and they get to do that, and it's going to create some discomfort and distrust and
Or that Uber model that Matt was talking about. That's fascinating. Where maybe it's not a fixed 8-hour shift, 12-hour shift, but something a little more flexible there. I don't know, Matt, Rose?
I don't see us ever coming to a standard. Right, because here in the Northeast, our travel expectations are different than if you're in Atlanta or if you're in Jacksonville.
Or the panhandle. the
Yeah,
longest
just wherever you
distances.
are, but,
Yeah.
or with a lot less congestion and you can get
Okay.
back and forth. I think that what is important, and again, I think it's with any time that you're managing or leading an organization is expectation. The terminology I use in our organization is clarity is kindness. The more clear you are with people, the kinder you are to them, because they understand exactly what the expectations are. And so in our organization, again, we're long-term care and we have a home health, and you know, most of our business is hands-on, so people have to be present.
Yeah.
I've actually tried to push it the other way, which is, can I mandate that my nursing directors don't come in 1 day a week? And I get pushback on that because I'm like, you need the mental space to stop and concentrate. And in a busy healthcare environment, you can't find that. You absolutely can't. And so I try and use it in terms of employee health and giving people some sanity around balancing work life.
Yeah.
The other thing that's interesting that we do in our organization is that I'm sick and tired of hybrid, right? We're going to have a meeting and if everybody's not in the room, then everybody gets on Zoom. I don't want a meeting with 3 people on Zoom and 6 people sitting at a conference room table. I can't hear you. What did you say? I can't see you. Can we switch screens? None of that stuff. So it's interesting that we'll have meetings where we'll have 7 people in our central office, all in their offices 100 feet from one another, because there's one person who can't make it. So And again, it's about setting that expectation that we will accommodate you. Because you need to use it for life balance. And again, in an industry like ours, and an organization like ours, it's not a lot of people. And we don't get a lot of pushback from caregivers that say, well, I can't work remote. Well, you can't. That's your job. We need you to be in front of
No,
patients. We need you
interesting.
to be in people's homes.
Yeah.
But we
And being
do
clear
use
upfront
it.
about that.
Yeah, so we have set expectations around that. We have set expectations around what a normal workday is. So when you're scheduling meetings, that our normal workday is between 7:30 and 5:30. That's when we do routine communication. No emails, texts, or messages outside of that timeframe unless it's an emergency. That's for a 24/7, 365 operation, folks, that our nursing directors get to go home and in theory unplug. When your phone rings, it's for real. It's not random, routine issues. And then when we do in-person meetings, it's 8:30 to 4:30.
Mm.
And then we try and do those in the middle of the day. And if we're going to have a meeting, we want you in person. And again, if you have a reason or something that, geez, I really can't, we'll accommodate that and I'll go to Zoom.
Yeah. Rose.
I just want to comment that that's what leadership looks like.
Did everybody hear this?
Like, that's what leadership
That's
looks
what
like.
leadership looks like.
So,
What, explain that.
well, first of all, super clear expectations, but accommodating, but I love the boundaries. One of the things we lost during COVID was any boundaries, lost them. And we're struggling to get back to normal work days. But unless the CEO establishes the culture, the business norms,
Mm.
everyone beneath the CEO will not know how to behave.
Yeah.
And so
Yeah.
that's what leadership looks like. That's what retains people.
Mm.
Your ability to say to a nurse director, no, we're not going to just go back and forth about a project coming
Mm.
up or a new building or, I love that. So thank you for being a good leader. As an HR professional, I just celebrate that.
Mm.
On the hybrid, so we really embraced flexible first environment.
Mm.
And we look at it and pretty comprehensively. So and we looked at it by role. If a job could be done remotely, then it would be.
Mm.
If a job couldn't be done remotely, could be done hybrid, then it's hybrid. And if a job couldn't be done remotely, then it's in person. And we created kind of a decision tree,
Mm.
and leaders determined it.
Mm.
We
So you
had-
kicked it down to the
we
operating
kicked it down
groups.
to operators, yep. And
Mhm.
so no one mandated anything.
Mm.
Now, we did have a few mandates where we did have some leaders whose jobs clearly could be done fully remotely. And they were like, well, no, you have to be in the office 4 days. And that we basically said, you can't do that
Mhm.
because you're going to lose those people
Yeah.
fundamentally.
Yeah.
And they would say, but how am I going to know they're doing their job? And so, well, how do you know they're doing their job now? Like when they were in the building, did you hover over their shoulders? Did you watch that they weren't on Facebook? Did you watch that they weren't on their phones? Well, no, I looked at performance metrics. Like, okay, so then you'll still manage in the same way. So we had to teach people to think a little differently. And then our clinical staff, of course, the majority of them have to be in the building.
Mm.
So, but where we could find flexibility, we did. So if you were in a large practice and you had multiple people scheduling, they would rotate out
Yeah.
and they would work from home
Sure.
scheduling, and then they would come in. And so
Sure.
we found opportunities for flexibility wherever we could. On the nursing side, again, I love the comment. We have a box, and we in healthcare are so conservative and traditional. It was my point about we don't like to change. So we've always been 12s in most locations, unless it's ambulatory.
Mm.
And so we started saying, no, we're going to create a flexible environment where we ask people, do you want to work 4-hour shifts, 8-hour shifts, or 12-hour shifts? And then we try to accommodate them. Now, yes, that's a lot more work for the nursing manager, for the scheduling team, but we have found that it has helped to attract and
Sure.
retain our people.
Yeah.
So then I have my personal perspectives about remote work and hybrid work. And I think it's hard. I think it's hard. I think it's really great for people who have established careers, have established relationships, and especially those who have young children at home. because your life is easier.
Mhm.
If you can stick the lasagna in and while you know, run to the bathroom between meetings, you're not worrying about a 1 hour commute. And you're right, the traffic is so bad. And you can, it's about work-life balance,
Yeah.
you know, that works. But what happens to our young people? And how do they understand business norms
Right.
and understand
Get
how?
integrated into the
Exactly.
organization.
So what I now provide guidance, and they're not mandates, but what I say to all of our leaders who have hybrid teams, bring them in together.
Mm,
So if you're going to have, if your teams are mostly 3 days a week, have them in together,
mm.
unless there's a personal circumstance, because then you start to build the team.
Sure.
You build the norms, you get to know each other. And I think that helps a lot versus what we were doing early on is rotating so that
Yeah.
someone was like in the office all the time. That was useless. That was a failed experiment. And now they are coming in cohorts
Mm.
and people are much more willing to come in if there's more people in. If you're gonna come in and sit in the room and put your headphones in and be on Zoom all day, it's a useless exercise.
But you know, Rose, I want to comment too, though. You mentioned Matt being a good leader. I want to comment on you. What you just explained to me is also about leadership. You're willing to experiment.
Yeah.
There isn't one fixed model, and you're willing to learn from that experiment and move forward with things that work and jettison the things
Yes.
that don't work. And
Correct.
so what? Let's,
Yeah.
you know, how do we do this all better?
Yeah, and I think it's gonna be iterative. I think Jeff said, we don't know what it's gonna look like. I don't
Yeah.
know, and I don't know that there's gonna be one standard, honestly.
Right.
I think it's gonna remain quite flexible. I was talking to a search firm a few weeks ago, and they were saying that they hear executives say, we want everyone in the office. But then executives who are looking for jobs refuse to move.
I love it.
So
love it.
so everybody's kind of trying to figure it out.
Yeah, right.
I think that, sorry, Jeff, I think
No,
that the
please.
trap that you fall into, or you have to be careful of falling into, regardless of the decisions you make, is that however you end up managing a hybrid policy, it has to be in the company's best interest,
Agreed.
not the staff.
the
So we had someone who said, well, no, Wednesday is my remote day. I'm like, that
That
doesn't
work,
work. for us."
yeah.
And then she said, well, that's the day I make all my doctor's appointments. And we're like, well,
Then
you're not
take the
working
day
anyway,
off.
right?
Yeah.
But
Yeah.
people will, if you give them that little bit of an inch, they'll take a mile, and it's our natural instinct, right? That's to protect yourself and in your own self-interest.
Mm.
Yeah, I just gotta add, whatever the future state is, I think, one thing I've seen that's gonna continue to be important is, I don't think managers by and large are equipped to manage people in a hybrid environment.
I
No one
agree
is
with that.
been taught,
Yeah.
I mean,
That's a
to
good
some
point.
It's
extent,
hard
it's the same
enough
thing,
face to face.
right?
I
But
agree
but
with
you've got
that.
people, different places, different times, flexibility, there needs to be a greater focus on helping them do that, right?
Right.
They're different skills in a lot of
Right.
ways.
And the latest Gallup data shows that hybrid employees are the least engaged.
Interesting, interesting.
So we have to figure that
Yeah,
out.
Last comment.
What was that?
What was your last comment?
So hybrid Gallup, which does engagement survey data, they've been doing it for years and years. Their last survey, their last major survey demonstrated that hybrid employees were less engaged, were the least engaged population.
I have heard on the flip side, though, well-run hybrids can be
Yes.
more productive. But,
Yeah.
that engagement question is an interesting one too.
And it's engagement versus happiness.
Well.
Because,
and
right, 'cause then
fulfillment.
the hybrid employee or the remote employee is the happiest, I would guess.
Mm,
It's funny. I would say it depends because you can feel
mm.
like you're not getting the promotional opportunities, you're not getting enough visibility, you don't get to see people. I think it depends. I mean, I have 3 kids, 2 of my oldest boys are working 28 and 25, and they both go to the office every day and have. In fact, one of them left one company in the middle of the pandemic because they shut down their Manhattan offices and said it's 100% remote. And he said, I'll never learn.
Hmm.
I will never learn.
Yeah.
So I think it's generational. I think it's complicated, but I think you do need to
It's
train.
generational
managers.
and it's complicated.
It's
And
very
with that,
It's very.
let me open it up.
Let me just make one
Yeah,
more
yeah,
comment
please,
on that,
Matt.
if you don't mind.
No.
Because one of the things that I brought up when we had our pre-call was I still subscribe to this idea that when we went dark during 2020 in terms of shutting businesses down, and that half the population that was at home was like, this is great. I want to live the whole rest of my life like this. And the other half of the population was like, I'm gonna go out of my mind
I'm never
if I
gonna do
can't
this
get
again.
back to the office. I do not want to
That's why
be
it's
at home.
complicated.
And I think that we as employers have to recognize those two different sets of population.
Yeah.
And again, for us that are trying to bring people in the office, the people who are going crazy at home during COVID are the ones that we want to be mining for future talent.
Mm.
And then recognizing the ones who are dreading leaving home, that there's an opportunity to accommodate them.
I mean, that speaks exactly, I've seen studies, and I, don't ask me to quote them, but both that hybrid remote workers have greater well-being and that they have worse well-being.
Yeah.
So you can find something these days that's
And
gonna.
it's not
100%.
necessarily split by generation, which
Yeah.
is fascinating to me too.
Yeah,
It can cut across generations.
I think
So,
it's super complicated.
Yeah. Let me open it up to folks here,
So-
please. Oh, and let me ask, would you identify yourself? And then do you want anybody in the panel or do you want a specific person? Sandy, how do you want to handle it?
I think you just laid it out perfectly. And I will
Cool.
try, I will
Thank you for
try
that.
to address some of the things, questions that are coming in from the online. So
Too.
we'll do that as well. I want to take the opportunity to be, since I have the mic, to ask the first question. This is something that, you know, we talked about massive shortage. So I'm interested in knowing what you think the role of your organizations, your various different types of organizations are in expanding the pool. Like, what is, you know, like, you can go to universities and say, you need to graduate more folks, but
Mm.
what are the roles of
Mm.
organizations in
Mm.
developing a future base of talent that's gonna fill your needs?
Mm,
I think it's gonna have to be a combination of a public, private partnership.
mm,
I don't think either the public side, so state governments or private organizations can solve this alone. I think we gotta do so many things. It's gonna be a patchwork quilt of solutions. So first of all, we should be removing the requirement for bachelor's degrees from a lot of jobs, right? So, because it's not needed for most jobs. We
Right.
should be moving to more of a skills-based environment. Second of all, we have to develop talent that isn't your typical talent. There's hidden talent everywhere.
mm,
So we just aren't good at finding hidden talent because they don't come up through normal channels.
mm.
And, you know, there's all sorts of bias in recruiting.
Yeah.
You know, we should be removing, you know, colleges from resumes and trying to look more at skills versus those
Yeah.
types of things because you miss a lot of talent that's out there.
Right.
And then we're gonna have to develop talent. So we participate in a number of grants. We have a Department of Education grant, a $5 million grant with the city of Boston, and it's a ready to work grant. And unfortunately, it's not been as successful in pulling people out of the community because unfortunately, they're not ready to work. They don't have a lot of wraparound. They don't have enough
Oh,
wraparounds
interesting.
for it. They don't have childcare. They don't have transportation.
Mm.
They haven't been in school in a long time. They're not ready for work. So we flipped it around and now we're aiming that grant to our workforce and trying to elevate them. So working with food services and our environmental services staff and our transporters and educating them, skilling them and providing them opportunity to grow. So I think we're gonna have to do a lot of everything because the shortages are gonna be so big that one thing isn't gonna work. So it's
Right.
gonna be a comprehensive set of solutions.
If you work in healthcare or in a lot of other industries, and you look at a set of regulations, it's all about what you can't do. And I think that we and again, in our Massachusetts Senior Care Association and the Assisted Living Associations need to make sure that we're working at the state and federal level to get them to say, this is what you can do and what we want you to do.
Mm.
And one of the things that we have these resident care assistants, these new titles that came out in Massachusetts during COVID that allow you to have someone who becomes a caregiver that isn't a certified nursing assistant. And that creates that first step of the ladder to bring
Yes.
someone in to start a nursing career.
Yeah.
I think that as an employer, it's up to us to create the opportunity or the attraction for someone to come and say, I want to join your industry. Right, because Rose said earlier about the amount of people that are exiting the healthcare professions, that it's up to us to start to say, well, here's the benefits and here's why this is a great career and a great work experience. And as an employer, I think that is central to what we should be doing.
Yeah, I had one very specific part of, I agree with all that. I think one way that, one barrier that can be removed, which I've been involved in organizations that have been attempting this, and really it's the benefit primarily is the social justice aspect, but can help hiring, is second chance and rehab hiring of
Yeah.
folks who have criminal backgrounds and other issues. Is a tendency, not to do that.
Yeah.
And there's some
We
state
can't.
laws we can't ask and be
Well,
on the
and you
box of
can't,
things.
for some jobs you
But-
can't, but not
Right,
all jobs.
Right, not all,
Not
where
all
where it's
jobs.
appropriate.
Right, exactly.
Going down that road.
And from
more.
a community impact,
Oh,
I mean,
it's
if we
huge.
don't help some of these people reintegrate back, where are they gonna go?
It's,
There are times you think, if whatever the job is, if they can't do this, well, what can they do, right?
Yeah.
The-
Exactly.
So,
it is very challenging.
I think right up front here and then back and please.
Thank
you.
So my name is Alex. It's pretty loud, but I work in a very much a traditional corporate setting. I'm not patient facing whatsoever. So my question is also open to everyone, but more in terms of performance measures and KPIs. So when you're talking about the hybrid, fully remote versus in-person work models, with COVID setting in, and we saw this in academia, we saw this when we returned to work, we saw a loss of learning basically from being fully remote.
Yeah.
Have you seen a difference in performance measures between those three different subgroups, people that are fully back in person in the office or in a patient facing setting versus the hybrid versus the remote? I'm just curious if there's some quantifiable data that supports the fact that you learn better as being in person rather than being fully remote, or if there's no correlation being seen so far.
So first of all, the age, Hamilton,
Yeah.
Yep.
Yeah.
my son went there,
Oh, no way.
Yeah. 2021.
2017, so pretty close.
Yeah. So I think it's a little too early, truthfully, to tell, because we did hire a lot of people, new people in the pandemic, sight unseen. We were hiring executives without ever having an in-person interview. It was just a crazy time. I think it's still a little too early. We've had teams reconsider the hybrid or remote status because of performance. But I don't know whether that's like new learning or whether that's just the team or the work they're doing so I don't have great data yet to show one way or the other whether it's having an impact on learning. I can have my personal opinion. It all gets down to intentionality of like really good intentional leaders with good training to help people be successful. But you know what? That's still required in the workplace. It's just more that you can get osmosis, like people help each other more. I tend to see a lot of use of teams. So teams, real teams, human teams, will keep a Teams channel open. And just like you would like jump over a cube and go, hey, so they'll just teams each other all day long. And so that's one way that they get a lot of learning for new staff. But I think it is hard, but we don't have any good data. Not yet.
Matt, Jeff?
We don't do a lot of true hybrid or remote work just because of the nature and size of our business. But I'll say two things to that. One is that we've gone from annual performance reviews and bonuses of our executives to quarterly. In those quarterly reviews, they get paid. And so it helps us, again, coming out of COVID, hold to standards. And the other thing is that I do what we call it book club, and I do it with our middle managers and with new executives that come in. I do a 3-part series on a book called The Servant Leader. And it's a simple book I probably read 25 years ago, but one of the lasting messages for me is that you set objective measures and goals for your staff, and all the other emotional and circumstantial stuff that happens around those goals is irrelevant. And so whether they're working remote or they're in person, they should still be held to the same standard. And it doesn't matter where they are or what's going on. And again, when someone is sick or even if they're an alcoholic and you're aware of that, here's where you are. in your performance? Is there anything I can do to help you achieve the goals that we need you to meet?
Mm-hmm.
And that allows them to bring their challenges in, but you got to just stay objective in terms of what you're measuring, regardless of where they are.
And that book was The Servant.
The servant leader.
Yeah, Jeff?
Yeah. I think, I don't know that, people learn differently, right? in Different environments and cultures. And I'm not sure. I mean, there's a lot of data out there that says different groups are being more productive or learning better or worse. I don't know that, most organizations will have the data or the intentionality to come out with a clear, definitive, like, yes, this is the answer, or this is the answer. I think in the end, they have to sort of pick their poison and go with their value and say, this is what I believe in, whether it's in-person collaboration. I want people to be there to learn from one another and see each other in the hall and talk, or not, right? And they just kind of do their best. They should track and have data, but in the end, I think it's really tied to that culture and what they want to promote. And if
Well,
that
and I-
means
and I hear-
sacrificing a bit of something else,
Yeah.
that's what it means.
And I hear all three of you saying, you have to have some standards, but you also have to experiment, have to be flexible
Absolutely.
and see what works. And we're all sort of working through this. Ed, let me see back here.
Can I take a question from the online?
Oh, yeah,
here?
please. And then Ed, back here.
So Ann Prestopino, who's works often with our programs, shout out to Rose and Ann. She says, I think it would be helpful for you, Rose, to speak to the evolving work on multidisciplinary teams for care provision and the sort of evolving roles of and work that APPs can do.
Yeah.
So, sort of less of the siloed work of nurses, and you're the PT and you're the, social worker over
give a little
here,
background on this,
speak
too.
to that a
Yeah,
little
and
bit.
Ann really is the expert. So Ann and I worked together for a long time, 24 years, I think. So, and I'm not the expert, just to be clear. Ann probably has a lot more information on this than I do, but the hospitals have been, and with Ann's leadership, had been really re-examining how APPs are used in our care environments. And in particular, how they are extensions of perhaps physician teams, or even taking on fully caring for their own panel of patients, or, doing rounds in an inpatient unit on behalf of the physicians without a physician actually partnering with them. So we are really thinking about, and I think that's kind of the point earlier around, what are we going to do about shortages of physicians? I think we're trying to figure out how to utilize a different multidisciplinary team to try to close some of those gaps. But that's especially important on an inpatient and procedural areas at the hospitals. That's where the
Sure.
majority of that work is being
Interesting.
done.
Interesting. Ed?
Thank you, Ann.
Hey guys, and thanks for the talk. My name's Ed Bowder. Obviously I'm here in cohort 10, and hi to everybody on the internet. When I'm not doing the startup here that I'm working on for the project here, I'm a staff paramedic. And one of the things I like to ask a lot of people in leadership, because EMS is kind of underrepresented, it seems like during COVID, a lot of management kind of got stuck in repetitive patterns. And it seems to be a problem industry wide. So I'm curious what you guys think about, or what you've done post-pandemic, or now that we're coming out of COVID, to sort of kind of get everyone kind of back into the management style, or get people to start leading again, as opposed to just kind of existing. I know we mentioned earlier that for a lot of time during COVID, it was just like, let's just get through the day. But now that we're getting through it, I'm wondering what kind of plans you've implemented in that. I also want to remind everyone that the Eagles beat the Patriots this week, so.
Barely. Do you want to take that? We were talking about that earlier.
I'll start. And so during, I might have actually been during COVID, or it's just before, I started to really stumble on this thing so my kids are in high school. I come home from work, we have dinner, and then when they open the books up to study, that's when I clean out my inbox. And so from 7:30 till 10:30 every night, I'm firing off email after email after email. And in a family business, I have a brother who's up at 4 a.m. and then he's starting to fire off emails, and she just went, oh, right? Because you get it. So that the emails don't stop until 10:30, 11, and they start again at 5 a.m. And I had this situation one night where I counted, I in round numbers now, but I sent out 25 emails one night. I was cleaning out my inbox, got 75 back.
That same
And I'm
night.
like, I'm the problem. I'm the one who's starting this problem. So then I started to realize that we had to start setting, again, boundaries and rules and expectations around around email, which is how I got to saying that we now have a 7:30 to 5:30 normal work day. That's when all our communication happens. In part of that, I had read this book, Indistractable. I cannot pronounce the author's name. Iyer or something like that. Iyar is his last name. In an effort to then start to declutter the expectations for our executive staff. And I went as so far to build a OneNote manual for in all of our executives. So you come in, you have a structure for your daily, your weekly, your monthly, your quarterly, and your annual meetings. It has a general agenda for each one of those meetings, which you can modify and add to. But this is what the company minimums and standards are. In there's a 2-page document about our expectations for what it means to be an executive in our company. 45 to 50 hours a week it is a minimum. It talks about how we use flexible time for you to spend time with your family, but when we need you, we need you. And so coming out of COVID, we've really reinforced this whole idea that there is a structure and there is an expectation to the way you're supposed to behave as an employee in our organization. And that was quite deliberate because, we've had a significant, I'm sure you have too, a significant amount of turnover of people who were just completely burned out after getting out of COVID. My chief nursing officer being one of them. There was no way I could recycle her somewhere in the company. And again, that's what starts getting you to say that we have to start protecting our staff. And you're bombarded all the time. And it doesn't end. So trying to set some boundaries, but that was a very deliberate thing for us coming out of COVID.
Matt, what I hear in that too is we need some structure, but that wonderful book by Lisa Bodell, Simple Wins, that when you're facing complexity, oftentimes the best response is to try and simplify and have a clear management cadence.
Yes.
When you talk about weekly, monthly, if you don't have that in place, then it's like herding cats.
Well, it's a free for all.
It's a free-for-all.
Yeah.
Exactly.
So we prefer the free for all.
Deep down.
24/7. We need to do what you did.
Well,
The idea of simplicity just made me think, and Rose, I think you mentioned something earlier on this, but while in many ways, managers need to learn how to manage in a different environment, the problems they're solving are often the same.
Yeah.
And I find myself saying to them, well, what did you do before COVID? Like you've forgotten how to I don't know, what would you have done 4 or 5 years ago? It's probably the same thing. But I think it's everything's shaken up and sometimes they need that reminder of how to manage and whatnot. And I'll just say when I was at an academic medical center before, I worked very closely with the EMS union and they were wonderful. My favorite group, very awesome people. So thank you for what you do.
how about over, please?
someone-
Please, sorry.
No worries. Hi, everyone. My name is Jasmine Jackson. I'm currently a pediatric emergency medicine fellow here at Brown, but I trained residency at Boston Children's. Hi, Ann. That's my CCP mentor. Thank you all so much for your time this evening. One of the themes that I'm picking up on is trade-offs. And in a situation where healthcare is so contextual and historic, trying to get to that transformation can be extremely difficult, and especially with you can't satisfy everyone. So I would love to hear a scenario from you all where what was best for the organization maybe made some hard decisions between who would feel left out by that decision. If you could say that, what strategies you use to bring people on board.
I have a real life example.
Hmm.
So
Thank
first
you.
of all, trade-offs every day, all day. When you have 83,000 people, there's no way to make everybody happy. So we just rolled out in June new benefits for 83,000 people. And we had historically a patchwork quilt of all of our health and welfare benefits. Every hospital did their own thing. Everything was different. So if you were a nurse and you worked at one hospital and you wanted to go work somewhere else, you literally had to rethink all your benefits as part of that transition. And it really prevented a lot of talent mobility and career mobility. And it's exceptionally difficult to manage, although that's not why we did it. It was also very regressive. So everyone paid the exact absolute same dollar amount for benefits, regardless of whether you were the highest paid earner or the lowest paid earner. So we just created a comprehensive aligned set of benefits for the entire organization that are the same, which means there's trade-offs. When you have a starting point that's different for every single hospital, you cannot get to the same unless you literally pick the most expensive thing
Yeah,
across the
everybody,
board, which we couldn't afford.
right.
There's trade-offs. And then the other thing we did, which I like to say we were very courageous, we implemented salary banding so that our highest wage paid more and our lowest wage earners paid almost nothing.
Mm.
And let's just say that was hard. And so we're still in this process. Open enrollment opens in 5 weeks. And but how we brought people along, we anchored in values. We were clear on the why. We were super transparent. We started really early. So normally open enrollment opens in October and you go the 4 weeks and it's fine. Most people don't pay attention. We started this communication with department chairs in April and constant communication,
Mm.
summer learning series, wraparound support, benefits counselors, new call centers,
Mm.
but tons of education, tons and tons of communication. And it doesn't really matter what change you're making. It could be nursing schedules in a unit. It could be a care model, as Ann was describing, where you're using PAs and NPs differently. The most important thing is stakeholder management,
Mm.
transparency,
Mm.
communication, listening. It's really key. What really makes a good leader. And it's hard and you're going to get pushback. But if you're anchoring your decisions on core values, then it's easier to explain to people. This is why we did what we did. There,
Mm.
it's anchored in our values.
I want to reemphasize the 3 points you just made there. Anchoring in the values, explaining the why this is important to do, not the what,
The
but
why.
the why,
Why is the most important thing.
and being transparent in the communication.
Yeah.
And I'll bet you even after all that communication, you probably ran against some people and said, we're doing what?
Oh, yeah. We actually know people will wake up at the end of open enrollment and go, well, excuse me, you're changing what? So, and we're prepared for that as well.
Yeah. Please, Samuel.
right.
I think
I'll
you-
just give you
Oh,
a
yeah,
quick example,
please.
just to,
Yeah.
because I think it's somewhat rather funny, but so we had to, we're in the process, we're almost done transferring the 8 locations in our organization to an entirely new operating platform. So it's all of the accounting, all of the billing, in some instances, the clinical and the customer resource management. So it's everything. And one of the big pieces was accounting. So I sat in a conference room with all of our accounting staff. And for those of you who remember the movie, but in the movie Austin Powers, I forget which one it was, that Austin Powers was on a steamroller and he was leaving at like a mile an hour or less. And the police officer stands in front of him like 400 yards away and says, stop. And the police officer doesn't get out of the way and gets run over. And so what I explained to the accounting staff was that we have to do this. The organization can no longer survive on the operating system that we're using. We have to do it. Your jobs are going to change. The expectations are going to change. And then talked about the job environment. We need every single person that we can in this company. But if you get in the way of what we're doing, it is going to run you over. There is going to be no emotion attached to it. There is going to be no fanfare attached to it. And it will literally run you over. And we had some people who didn't get out of the way. And we couldn't have that. I did the same thing without the picture for our executive teams and made them understand that this is bigger than me. It's not something that I want to do. It's something that we have to do. And we just set that and we're shoving this down your throat. One way or another, it has to go that way, and it'll be collaborative, and we'll do it in
Provide
pieces and
support.
time. But I think it's one of those things like you're talking about, that we had a situation where there was no arguing, there was no but me, but my department. You just had to do it.
But part of leadership, and then Jeff, dive in here too. Part of leadership is you can't be having those transformative efforts every other week. So which things you pick to say, you're either on the train or you're not, while you're running the train.
Yeah.
Right. And we don't really do that.
Yeah,
Right.
Yeah.
So that was a pretty
Right.
unusual circumstance.
Yeah.
for us.
yeah.
I just gonna add, I mean, we touched on this, but this idea of trade-offs and the communication and the values, it's also important to make sure that the people who wake up at the end or after it's too late, or have their personal issues, that they're heard and that they have
that's
a
exactly right.
platform to communicate that. And obviously there are limits where you're not gonna hear every person's personal gripes endlessly, but that, people feel heard and have that opportunity to speak up, and often that's enough.
Yeah. I agree.
Yeah, which again comes back to what you started with, listening.
Exactly.
Please, Samuel.
Sure. My name is Samuel Tassi Younger. I'm a medical science liaison for a pharmaceutical company. But for context to my question, I'm also a foreign medical graduate. So when I listen to the data and a 430,000 shortage by 2030 of providers, I'm interested in knowing more about what is done to remove obstacles for foreign providers to practice in the United States. I know everything from, there's so many obstacles to get into residency. There's so many unmatched IMGs out there. There's so many who are moving to other careers. And then there's also visa issues that reduce the ability for them to move from one job to another. So I just want to know at your different institutions, how you're tackling that problem. If it is something being at the state level or federal level. I know during COVID, New York took some moves to, bringing more people into the workforce. But after COVID, what is happening and what is the outlook like for the future?
I think this is a federal government mostly issue.
Yeah.
We're really restricted on the visas that we can support, the H-1Bs. And I'm not an expert in how the residencies, determine who they select or don't select. I think I personally think that we need to expand immigration to support some of these jobs. We're not going to be able to fill these jobs. I think that's just my personal opinion, but I don't actually know enough about the foreign trained graduates and medical and, the residency programs to be able to speak to it effectively. I don't know if any of you do.
Yeah, no, I handle immigration, but not on the side of provider, so I wouldn't be
Yeah.
well equipped for that one, unfortunately.
I recently heard about a few states, the specifics escape me right now, but they have opened up IMGs who have not gotten, don't have a USMLE pass, but they're MBBS, for example, or they're hold some kind of doctorate in their own countries where they can practice under the supervision for 2 years, and then they will be eligible for a state license.
That makes
And
sense.
so there are moves being made in specifically in states where there's a paucity of primary care physicians, under the caveat that they will practice primary care.
Yeah.
If you have a nursing license in this country, regardless of where you're born, you can't go work in every state.
Yeah, that's one
I
of the
mean,
big
it
barriers.
is a mess from top to bottom.
And that is
Physicians too.
state to state also, so.
That's state to state.
Yeah.
right?
Yeah.
That's one of the big challenges with virtual care.
Sandy, I
We
think.
expanded virtual care, but
Christian.
now you can't actually care for, you have to have a license in that state.
Mm.
It's madness, really.
Christian.
Hello, how's it going? My name is Christian Sorensen. I'm a family medicine PA from Maine Health, and I actually did my training at Mass General. So,
Fantastic.
so my big question is obviously geared towards probably APPs and how they're being utilized. With the primary care tract, we need more primary care providers and kind of utilizing APPs to fill that gap. How are they being protected from being overused and kind of burdened? So for being forced to kind of treat the same that a physician would, but for less compensation, first off. Second off, what is the resources in play to provide them with the necessary, education or resources for reach outs and support, and kind of just curious on how they're being utilized. And then a third question to that, I apologize, and kind of how, so I'm listening to kind of all of you, not all of you, but the kind of the approach to hybrid and how you're not necessarily in support of it, or at least that's how I kind of took it. But based on with primary care and how you can incorporate hybrid models into that, as well as the home health care, and kind of how you're able to incorporate telemedicine into home health and having providers actually go into the homes. I'm just kind of curious on all of those things, and I apologize.
I'll start backwards because I
Yes.
forgot the first question, but so first of all, I actually support hybrid. I worry about our young people. But I actually authored the Flexible First program at MGB. So and our physicians actually do a lot of telemedicine.
Mm.
And I think that's actually been a well-being kind of approach to be able to do some days from home, full days from home, and some days in the office. And again, it depends on your patient panel, because if you have a much older patient panel, may not be as conducive to it. But I mean, my daughter gets her care at MGH, and she often sees her physicians remotely.
Yeah.
It's fantastic. So I would say we have a long way to go to sort out the full APP future.
Yeah.
Right? I think the PAs at MGH might say they don't feel like they fit in nursing, and they don't really feel like they fit in the physician environment. And so I think we are really at our kind of infancy stage in figuring out where we're going to go with the full use of APPs. And, you know, if you're an APP in a procedural area, you actually may make as much as a primary care physician. You know, I mean, it just depends. And the bigger question is, you know, how do we make sure we protect primary care too? Because that's
Yeah.
from a comp
Yeah, just
perspective.
don't
which is
drain
really-
off.
Right, exactly. So, but I think we have a long way to go. So I don't think there's I don't have any magic bullets or any like clear answers. We're just sorting it out now.
Please.
Hi, I'm Ann Nicholas. I'm an attorney practicing labor and employment law as well as some immigration. But my former life was a nurse manager in a critical care unit at a major medical center. And my question kind of goes to all of these things in terms of retention and trying to balance hybrid versus in-house, and as well some of the benefit packages that we're looking at in terms of employee wellness and how that's impacted your labor negotiations. And I mean, certainly with these large organizations, you have many different labor contracts to try to work out and balance. And I just would like your perspective. I know this is dating me a little bit, but from the institution that I was at, we had used some mutual gains kinds of bargaining, and that took a lot of time, and it sort of fell to the wayside. And for a while, people were happy, but then some of the contracts were really difficult to negotiate and came pretty close to work stoppages like what we saw in Minnesota. So I'm just wondering if you could kind of elaborate on how trying to balance all of this from a workforce standpoint impacts your negotiations with labor contracts.
Glad you came.
I would say it's really hard. So we actually, you know, the bio that Sandy read said we have like 24 bargaining units. I think we're up to like 29 now. It is a very different environment. And I think the NLRB and some of their rulings are going to make it much easier for employees to organize. And so I think from a contract perspective, we have contracts that are very varied. And so some have provisions built in that they have very specific cited known like benefit programs. So everything has to be bargained. And then we have some that say they get what the rest of the house get. And those they just adopt what we have. And we're constantly figuring out where the trade-offs are. But the pandemic has made labor issues so much worse. I mean, so much worse. When I first started in this role 6 years ago, I probably discussed labor issues maybe once every other week with my senior team, the senior leader who was responsible for labor and employee relations. It's probably a daily occurrence.
Daily.
Yeah. Yeah. It's probably a daily occurrence.
So I spent almost 15 years focusing a lot on contract negotiations and representing management. And I was not disappointed that I left just prior to the pandemic and didn't have to negotiate contracts in that environment. It was a happy coincidence, but would say more broadly that, you know, the one thing, and this may, I'm sure this is more difficult now than ever, but you know, the thing that we found very successful was really, and it takes a partner who will do this, obviously, but flipping that adversarial paradigm and really getting into collaborative relationships where it's mutual wins, and then we created unit-based teams and really took a deep Lean Six Sigma approach with feedback and building you know, close relationships with our unions and their members, and it was excellent.
I mean, that's really the only way to be successful.
Yeah.
I mean, there are no union employees. They're all our employees, whether you're part of a union or not. So we have to build and maintain deep, positive relationships. So they're the people caring for our patients, and there are people we want to care for them. Sorry.
Maybe one more question?
Yep, I think we have time for one more
Please,
question.
one more. Yeah, hey.
Hi, I'm Ed Teleferro from Lehigh Valley Health Network. Real quick question. I know we have a national shortage in providers at all different levels. What I'm concerned about is that when we're trying to expand the ability for providers to address patient care needs, is that we create a tiered system of healthcare for as far as the patient is concerned, as far as quality of care. Where now that you know, if you go into a healthcare organization, if you go into a hospital, you're not sure if you're going to see an attending, you're going to see a resident, you're going to see some other subspecialty. And I'm concerned that what happens to communities, especially where there's shortages, that you are going to get, you're going to have access to something, but that something is going to be something less.
I mean, I'm happy to weigh in. We have a huge platform focused on community health and health equity. It is one of Anne Klebansky's #1 platforms. One of the things she's drives home and talks about all the time. We're actually driving care into the communities, because that's actually where care needs to be provided. So we have mobile vans to provide care. We're embedding all sorts of wraparound support. We've got very key objectives and key performance metrics for improving the health of our community. So I do think that's a risk. And I think we as a collective industry need to continue to work really hard to ensure that all of our patients get the best care and the care that they need. And ideally, with culturally competent providers, people who look like them and embedded in their communities. That's the ideal state. It's going to be, we cannot take our eye off this ball.
I will go a step further and say, let's not sugarcoat this. Everything is being watered down. And so the example that I'll give you is that for pre-COVID and before we ran into this labor situation, that most of the time I could hire an RN in my business, they'd stay 1 or 2 years because the hospital wouldn't hire them. Hospitals started hiring new grads.
We hire a lot of new grads.
And then I'm using a lot of LPNs because I don't have RNs. Hospital starts hiring LPNs. And so I'm not even getting the 2 years out of my LPNs for being a new grad before they're going to the hospital. An LPN, for those of you who don't know, is an associate's degree, right? And so we have decision makers all over healthcare, and not just in my industry, but everywhere, that are LPNs, where 5 years ago or 4 years ago, it was going to be a seasoned RN in that position. An RN in the hospital was getting trained and getting mentored and moving through that system, and that's not happening. So not even for your primary caregivers, your physicians and your high skilled, your hands-on caregivers are all being diluted as well.
Yeah. And that's the care, those are the shortages in healthcare.
Jeff, any?
I'm gonna defer to my esteemed colleagues in this one. They got it.
Yeah.
Can I ask one question? How are you all utilizing MAs at this point to get everything done? Because essentially with the LPNs being cannibalized by the hospital system, how are you utilizing MAs, or are you looking to do that? I know from my hospital system, and I apologize everyone, I'm Christopher Rockmore. I'm Assistant Vice President of Operations for Oxnard and New Orleans. We are actually having to upskill our MAs to also take images for our rad techs that we don't have at this point in time. So they are turning into limited license rad techs, going through, different programs to figure out how we can upskill them because we don't have nurses in our area, to be honest with you. So what are you all doing to, I guess, upskill and get them to top of scope?
That's the grant that I mentioned is one of those grants. It's for MAs. I mean, we're basically finding other resources in the organization to upskill them to become MAs, not because they're necessarily being pulled away, but because we can't hire them either. We can't find MAs. So, I mean, I think what you're really reinforcing is we have a real crisis.
Yeah.
Like we have a real crisis, and that's what you
Yeah.
were saying. We're, where we would have had an RN, we have an LPN. Where we might have had a rad tech, we now have an MA with the limited, I mean, you've just kind of summed up the real problem.
Let me pull us all to the close. We started with where will the US healthcare system be, and now we're all really pessimistic about it. Anyway, let's give a round of applause. Yes, thank you so much. Thank you all for your time. Sandy, any concluding remarks?
And thank you to all the folks who joined online. Sorry we weren't able to get to all of your questions, but we can filter those out. And thanks for joining us here at Brown University tonight. Thank you.
Thank you, Sandy.